Recording.
Good evening, everyone. Welcome back to the page, and thank you for being here today. I wanted to talk today about a basic curve plan, right? This is going to be curve plan 0001. This is not even curve plan 101. I'm going to make it really, really simple so we can get some of the main ideas when it comes to curve plan. Yes, it is true what you have heard about these curve plans out there. You will never have to make a curve plan like this, like you make it in school, in real life. However, the the curve plan itself, or the thought process that goes into a curve plan, you will have to make about 1,000 times a minute, 1,000 times a day, every day. So this is a very important process, right? The first thing that I want to say about this is that no matter what school you go to, you're going to encounter some sort of a form that that particular school uses for curve plans, right? In this case, I'm showing you this one. It may differ a little bit from the one that you use in your school, whatever the case might be. It's just about the same thing, right? In this first page, it's kind of obvious what you have to do. You just need to collect information from your patient and input that information in the right space, right? Always have your admitting diagnosis, your secondary diagnosis, which may or may not be necessarily at this point your primary nursing problem, right? You may have come in a week ago with respiratory failure. However, today all of that is resolved and you just have constipation. So the priority problem is constipation, not respiratory failure that happened a week ago, right? So just so you can have an idea. And this page is just go ahead and fill it out to the best of your capacity with all the information that you have. My tip to you is that if you don't have an information or it's non-applicable to your patient, just go ahead and write non-applicable and don't leave anything blank. Most professors will not like that. Okay. The same thing goes for here. Those some of the diagnostics and treatments and therapies and interventions. Um, Same as the first page. You're just putting here to the best of your knowledge. This is not the meat and potatoes. What I want to talk about in this particular slide, vital signs. Vital signs are one of those things that no matter what happens, you must have at the very least, the absolute minimum should be 2 sets of vital signs. Because I want you to think about this. If you come in with, I don't know, a headache, right? And I check your vital signs and your blood pressure is really high. I establish that you have a headache because you have hypertension, right? So I am going to give you number one, something for your blood pressure, number two, something for your headache, right? To take the headache away. And then, half an hour from now, when that medication kicks in, I will come back, I must come back and recheck your vital signs to see if the medication I gave you is working. How do I know it's working? Well, your blood pressure is coming down and your headache is getting better, right? So at the very least, you need to have 2 sets of vital signs. This is self-explanatory. Go to your medication book, pharmacology, and input the information that they're requesting on this page. Same thing here, labs and diagnostics. Now, lab and diagnostics, what I want to say about this is that it needs to be related to the process that you're developing, right? If we're going to talk about a UTI, you cannot have a CT of the head. Right? There's no reason for a CT of the head if the problem is a UTI. However, you must not miss a urinalysis with culture because it is a UTI, right? So these labs and diagnostics must be related to the process that you're developing in your care plan. Okay, and last but not least, this is the heart of a care plan. This page over here. It may look different in different schools, but it's all the same. Let's begin with nursing diagnosis. A nursing diagnosis, right, is composed of three parts. Number one, the problem. Number two, what this problem is related to or caused by. And number three, what evidence do you have that that is the problem that's happening in this patient? All right. So a nursing diagnosis is different from a medical diagnosis because medical diagnosis tells you a disease. A nursing diagnosis describes a problem within that context. Let's take a look. For example, let's take the medical diagnosis of, I don't know, angina, right? Angina is also known as chest pain. Let's go ahead and write these in nursing terms. We know that angina, that is cardiac in nature, is because of a narrowing of the coronaries because of atherosclerosis, causing a decrease in blood flow, causing a decrease in perfusion, therefore causing ischemia and pain, and so on and so forth. So my main problem here is one of tissue perfusion. Why do I have this chest pain? I have this chest pain because the blood's not flowing through the artery, it's not feeding that tissue, and that tissue is ischemic, and therefore it hurts. So the diagnosis is ineffective coronary tissue perfusion, right? But related to what? What is causing that ineffective coronary tissue perfusion? And please always say, where is the problem? It is in the coronary, it's in your heart, it's not in your leg or butt cheek or ear, right? It's in your coronary. But let's go back and see, what is this problem related to? What is causing this lack of blood flow through the artery, therefore not feeding the tissue and causing the perfusion to be ineffective? Well, narrowing of that artery because of atherosclerosis, right? That is the cause of it. And of course, you don't know this because I didn't tell you at the beginning of the thing, but for example, the evidence by what evidence do I have that this is happening? Well, I have a positive EKG, right? Alterations in vital signs, such as a high blood pressure or rapid rate. Maybe your patient is presenting obviously with chest pain, shortness of breath, right? And all those things that are indicative of a cardiac problem or objectively indicative of a cardiac problem, right? So these guys here in green are telling you, hey, you got a positive EKG, you know, you are having an MI, right? And I know that because, well, you know, it's objectively, the machine is telling me you have a positive EKG, right? And I know that these alterations in EKG happen when we have a problem of atherosclerosis that causes that ineffective perfusion that eventually leads to chest pain. And all of these go here in your nursing diagnosis, okay? So all of this goes here in your nursing diagnosis. Now, the next stop over, your NOC, N-O-C, desired patient outcome or goal. Your goal is what you want to achieve. And if we go back to that headache situation that we discussed before, where a patient comes in with a headache, well, in that case, your goal, your overall goal is to take away the headache, right? So if the problem, also known as the nursing diagnosis, is a headache, your outcome is to take that headache away. However, that outcome needs to be measurable and time frame, right? I want that headache, or let's continue with the chest pain, right? Let's go ahead and continue with chest pain. I want effective tissue perfusion. I want effective tissue perfusion in 90 minutes as evidenced by blood pressure 120. Sorry. Blood pressure 120/80, heart rate 100 or less than 100, sat at 95%. Okay, those things that you saw in the evidence by part of the diagnosis, right? Those are the things that you want to see changing over here, because the as evidence by part of the diagnosis is the evidence of you having a problem or your patient having a problem actually. So that is what you want to reverse, because if you want to you want to reverse the process, and once you reverse the process, those are the things that are going to indicate that you reverse the problem, right? And you want these things to happen within 90 minutes. In this case, I'm choosing 90 minutes because of a specific reasons that we're not going to go into. You know, if it was a headache, for example, you would say, I want this headache to be 0 out of 10 within the next 30 minutes after Tylenol, right? So you give it Tylenol, you're going to wait 30 minutes, and by 31 minutes, it should be 0 out of 10. That's your goal. But what I want you to see here is that that goal is going to be measurable, and it's going to be time framed. Okay. Now the next step over will be the NIC, or your nursing interventions. Your goal over here is what you want to achieve. The interventions over here is how you're going to achieve them, right? Let's just continue with the ineffective tissue perfusion guy. You know, so we're gonna do interventions. Number one, and I'm gonna write it here in the note, but these really belongs over here. Okay, I'm just gonna do it like that because I don't have space in the screen, right? But number one, any patient that comes through your door, regardless of whatever the presentation is, the first thing that you're going to do is vital signs. Vital signs for everyone. It's the first thing that you're going to do for every patient. But why do you do vital signs? You have to have a rationale. And then again, that is this part over here, rationale. Okay? You have to have a rationale for everything you do. Vital signs, well, you know, I want to establish a baseline. Okay? For later comparison to it, right? I have to come back later on and say, well, she came in at 200/150, and right now she's a 120/80, which is getting better, right? Then number two, this is a cardiac issue, right? So we're going to put this lady, this guy on the EKG or telemetry, if you want to call it telemetry, you know, telemetry. Why? Because I want to monitor that rhythm. Right? I want to monitor that rhythm, make sure that I keep an eye on that rhythm. It is a cardiac problem. Number three, we said that it's a problem of tissue perfusion, right? And remember, see, I want you to see how I keep on coming back to the problem. The problem here is one of tissue perfusion, is one of blood not getting there, and with blood not getting there, the oxygen in that blood is not getting to that tissue, and therefore that tissue is not effectively perfused. Well, I'm lacking oxygen. All right, sure, no problem. Let me go ahead and give some oxygen, because I want to keep that saturation above 95%, right? You want to keep your patient saturated. Number four, I know the patient is having an MI, the EKG told me, but what I don't know is how much of an MI this person is having. Well, let me go ahead and send some labs. Okay, let's go ahead and send some labs, and those labs, you know, need to be related, then again, to the process that you are developing. In the case of a chest pain, you need to send cardiac markers, right? Troponins, CKMB, VNP, so BNP, so on and so forth. And then last but not least, out of the basic interventions, last but not least, is medications. You know, we can assess all we want, but if we don't do something about it, we're just going to end up with a very nice record of how that patient turned blue in front of you, died, and that was it. Very nice, very detailed record of how your patient died, but the patient's going to die. You need to do something about it, right? And one of the things that we do is give medications to correct the problems, right? In the case of a chest pain, we're going to use the classic Mona right now, right? Morphine for the pain and oxygen consumption by the myocardium. Oxygen, because obviously the person needs oxygen, which you already gave here. Nitroglycerin to allow for, open up those pipes for the blood to go through, and aspirin and as an antiplatelet. Okay. However, these got your patient stable. You need to fix the problem. The problem of ineffective perfusion you haven't solved. We got the patient stable. We took the pain away. We gave oxygenation. We got the patient stable. We bettered the situation, but we haven't fixed it. Number 6, intervention number 6, this guy is probably going to need perfusion. Let's just go ahead and say that he needs a stent. We nurses don't do stents. Cardiology does that. Interventional does that. So we're going to call MD, you call the doctor, and you report, hey, come see this guy, he may need a cath, right? And in the meantime, because you're suspecting that your cardiologist is going to come in, take a look at the eye and be like, no, let's go ahead and prep him up to go to the cath, immediately start right now, because you know that probably that's what's going to happen. Go ahead and start prepping your patient. Go ahead and get that consent, give medication, explain what's going to happen, hand some fluids, start a couple of IVs, so on and so forth, right? And that is your set of interventions. And as you can see, there's 7 interventions, not 1 or 2, 3 minimum per diagnosis. Every time you have a diagnosis here, you need to have at least 3 interventions, right? 3 goals, you need to have 1 diagnosis, 1 goal, at least 3 interventions, each one of them with its rationale, and that'll bring us to the last column, evaluation. Now, evaluation is directly related, or perhaps I should say, inversely related to your outcome. Okay? Sorry, not inversely related, directly related to the outcome, right? If my desired outcome over here was for that, I don't know, chest pain 0 out of 10 and reperfusion in 90 minutes, for example, okay, then my evaluation is gonna say something like this. Chest pain now, 90 minutes post admission, right? At 0 out of 10. That means that my intervention was effective. Comma, patient now en route to cath lab. That means that within those 90 minutes, right? He is going to go, or he is right now within 90 minutes and going to cath lab for reperfusion. Okay, so whatever it is that you say here that you wanted to achieve, and within that time, you need to achieve over here or not. If you don't achieve it over here, that's okay. You can just say, well, I did not achieve, instead of 90 minutes, for example, he got there at minute 101. I don't know. Related to, I don't know, the stretcher was missing a wheel, or whatever the case might be. And then you reassess the situation and reevaluate your patient and redesign your care plan. If your interventions, if your goal and the interventions that you did for your patient did not cause a good evaluation, then you need to reevaluate and begin the process again, right? However, if it did, if you wanted no chest pain, then pain here should be 0 out of 10, the same thing. This is what you want to achieve, and this is whether you achieved it or not. And that is the meat and potatoes of a care plan, because this page right here that you're seeing right here, this is the most important part of the care plan. Everything else is secondary to this page, because in this page, you show your critical thinking. You show your capacity to gather information, organize information, and apply information, right? How you develop this part of the care plan basically says whether or not you're going to save your patient. This is the page you need to be concerned about, and the page that you absolutely must get right. Okay. Now, the next one is your nurse's notes. A lot of institutions are using SBAR as a mode of reporting nurses' notes and so on and so forth. If you want to use SBAR, SBAR stands for situation, background, assessment, and recommendations. And let's just go ahead and take a quick look at that guy with chest pain. An SBAR for that particular patient with the chest pain presenting with an MI, right? It should be a simple one. SBAR is not for you to write a dissertation on chest pain or dissertation on that patient. SBAR should paint a picture from a bird's view of the case, right? The whole picture as to what's happening right now and what needs to happen in the immediate future. For example, situation, patient came in with chest pain, positive EKG, and positive cardiac markers. Okay, so he's having an MI. Background, this patient has, a history of hyperlipidemia, hypertension, diabetes, and he's a smoker. Right, so now we know that all these risk factors are pointing this way. Okay, my assessment. And you know what? Based on this information here, based on giving his history, and based on this information that I have here, it looks to me as though this guy is having a cardiac issue, right? Some type of cardiac process. Let's not go ahead and call it an MI, because that is a medical diagnosis, and we don't want to get into that. But let's just go ahead and say, hey, that chest pain looks cardiac in nature to me, right? So here are my recommendations. I'm checking his vital signs. I gave him some oxygen, right? I gave him some meds, which is in this case Mona. I gave him some Mona, right? And then I call the cardiologist, and they're prepping the cath lab. What you, the person I'm giving report to, needs to do next is to, whatever is pending, what you need to do next, you, the person coming after me, is get the consent and transport the patient or something like that, right? And that will be the end of it. That's your note. But it needs to be threaded. Guy came in like this. This is a history, and this history makes sense in the settings of the presentation. This is my assessment. This is what I thought, what I think it is, right? And this is what I have done so far, and what you need to do after I'm gone for this patient. Simple as that, right? So I hope it helped, and it was clear enough, and hopefully it's something that you can go back and review again and again until you make sense of it. If you got any questions, any concerns, feel free to reach out to me. Be more than glad to help. And if you liked it, give it a like, leave a comment, so on and so forth. All right, guys, thank you very much.